Soft tissue vascular tumors and malformations, neurofibromatosis of the maxillofacial area in children, classification, etiology, principles of diagnostics, differential diagnostics and treatment methods, and postoperative management of children with benign malformations. Classification of all tumors are presented in this slide. What most important, tumor is a pathological process. This regulation of cell growth and differential due to a change in the genetic apparatus. But tumor-like neoplasm is a pathological process where cells do not have mitotic activity and growth occurs due to cell hypertrophy. You can see the last classification, practical classification that we use to make the diagnosis of the tumors of soft tissue in pediatric surgery. We have two groups. It's vascular tumors and vascular malformations. From vascular tumors, the most common is infantile hemangioma. So in this lecture, we will make our view mostly on this type. And from vascular malformation, the most common different forms of malformation. It's like the capillary, venous, lymphatic, or arteriovenous malformations. What is infantile hemangioma? This is proliferating endothelial cells of the capillaries and pericytes. Mostly common infantile hemangioma occurs in 4 to 10% of all infants and children. In maxillofacial regions, it's from 68 to 80%. And in a few anatomical areas, it's about 20%. It is common knowledge that the late stage of pregnancy are associated with statistically significant risk factors for infantile hemangioma. It's like the placental insufficiency, treated miscarriage and medication maintaining pregnancy, multiplied pregnancy, cord entanglement, preeclampsia, and so also the mother's age over 35 can be the cause of this type of disease. Infantile hemangioma have the 4 stages of development. First stage is initial manifestation. Second stage of active growth can be till the 1 year. Third stage of involution, it's still 2 or 3 years. And the last one, stage of residual manifestation, it's above the 3 years old. What additional methods of examination we use by this disease? In first place, it's Dopplerography that we can use in all types and all children with the hemangioma, and also the MRI, what can be provided only by the anesthesiological support, because children are mostly infant and can't lay in this examination. How we provide management of infantile hemangioma? It depends on the stage of this disease. On the first stage, we use the medication therapy. It's non-selective beta blockators, and sometimes we can, with small size of hemangioma, we can use the applications with the timolol. In second stage, the proliferation stage, we use the medication therapy, the same non-selective beta blockators with corticosteroids, and with the small sizes of the hemangioma, less than 6 centimeters cubic, it's sclerotherapy with mostly with diprospan. In third stage, involution of disease, we use the same beta blockators with corticosteroids. And in the final stage, surgical removal of the scars and laser correction of the scars. In this slide, you can see the one of the treatment methodic. It's non-selective beta blockators with propranolol. On on the left side, it's before treatment with the Dopplerography with a lot of small vessels, and after treatment we can see on the Dopplerography only normal size and counts of the vessels. What indication for this treatment? It's infantile hemangioma, which grows rapidly and occupies several areas. The treatment period with the propranolol it's from 6 to till 8 months. And also we always use the control during treatment. So control of the heart rate, blood pressures. Mostly we use the Holter monitoring and glucose level. Another type of the small tumor vessel diseases is phyogenic granuloma. They acquires the vascular tumors consist of capillary proliferation after some trauma. In clinic, we can see the development of small erythematous papules on the peduncle. It's always mostly location on the skin, mucoses, on the areas which mostly traumatized. It can be on the lips, on the brow lines, less in the cheeks or infraorbital area. These tumors are growing fast, easily bleeded, and patients come to clinic mostly with the cause of the bleeding from the tumor, and it can recur. Treatment of phyogenic granuloma, only surgical treatment. We can use like the scalpel, the same laser and diathermal coagulations. It depends of the sizes. With the big sizes of the tumors, like in this picture, we can mostly use only the scalpel, like in this case. But in the small cases, like you saw in previous slide, we can use the laser therapy or diathermal coagulation. Vascular malformations. It's non-tumor disease. It's congenital, manifested at different ages, have slow growth, does not regress. The push to growth after some trauma or viral diseases or hormonal outbreaks, hormone therapy, pregnancy, so on, it can be pushed to fast grow. These malformations contain capillary, venous, arterial, lymphatic vessels and their combination, and can lead to dysfunction of breathing, sucking, chewing, swallowing, speech, vision, so on. Venous malformation in the embryonic development of venous network, which leads to the expansion and dysfunction of veins with the lack of smooth muscle cells. 90% of venous malformation arise sporadically with unilateral location. And by the clinic, we will see that it's manifested at any age, have slow growth, do not regress, the same like the all malformation. Have the positive symptom of devastation feeling, presence of phlebolites, pain in thrombotic form when we have the phlebolites, and excitation of function and localized in intravascular coagulopathy. Additional methods of examination. We use the same like in all tumor or tumor-like disease. It's Dopplerography, and in Dopplerography we will see the slow flow Doppler curve. And also the macro and micro fixtures. Also in the we can use the MRI. We will see the determination of boundaries anatomical and topographic position, and we can see the cause of the dysfunction. Also we need to check the Tells count, coagulogram, and the dimer. How we treat this disease? On last time, we use the foam technique sclerotherapy, mostly with etoxysclerol or sometimes with bleomycin. Also, it can be used as surgical treatment of removal of the sclerot wound tissue in combination with locally plastic techniques. Also, laser therapy when the malformation have small sizes. What advantages of this treatment? It prevents the thrombosis due to the action of sclerosant directly in the field of venous malformation, and preserve the anatomical shape and size of deformed areas. Arteriovenous malformation, one of the hardest malformation for treatment. It consists of the arteries and veins in some location. It can be also manifested in any age, have the slow growth, do not regress, and can be activated after the injuries, the same like the old malformation. And the most hardest type of malformation is anterior venous malformation of the jaws. It can be it can have the late diagnosis after some bleeding. That bleeding can lead to the death of patient. So we need to know the clinical signs of the malformation of the jaws. There are some of them. It's vascular spots on the skin or mucosa. It's jaw deformity. It's change of position and mobility of teeth without any caries or periodontic diseases, and also bleeding from the gums while brushing the teeth. In additional methods, we use Dopplerography. In Dopplerography, the most common, we will see the presence of the shunt. And also in these types of, in this form of disease, we use the CTA. It's CT with contrast fluids. By this examination, we can see the blood supply vessels for this malformation, and can make by the examination the first stage of treatment. It's embolotic closure of the blood supply. Also, we use the angiography of the arteriovenous malformation. By this examination, we will see the hemodynamic disturbance of symmetrical areas, options for connection of anastomosis, and status feeding and draining vessels. How we treat the arteriovenous malformation? In remission stage, if we have one anatomical area, we provide the surgical treatment, removing of malformation, and if we have the several anatomical areas, we combine surgical treatment after the embolization in the stage of the CTA or angiography. In stage of active growth, we use the embolization plus surgical treatment. By this treatment, we always need to determine the lead and drainage vessels at CT and try to save and change skin flap. And the vascular occlusion provided in the stage of the examination give us less bleeding after the surgical treatment. It can be used by the palliative treatment before surgical removal or treatment efficiency of arterial venous malformation with jaw lesions. Um, Surgical intervention, it's conducting organ preserving surgery on the jaws, and timing of the optimal tamponage of the bone cavity. It's 2-3 days after the endovascular occlusion. If we will do it after 3 days, embol that stay there are already resorbed, and we can have the big perfusion bleeding. Capillary malformation. It's congenital malformation of the development of dermal capillaries and postcapillary venals with the absence of neuronal blood flow control. By the clinic, it occurs in 0.1% of newborns and grow in proportion to the growth of the child. It persists through life, have always positive symptom of devastation feeling, and we can see the hyperplastic skin change with age, and some dysfunction with age. Additional methods we use the same like the all tumors of soft tissue. Dopplerography. By this we will see the sinking of the skin, and slow blood circulation is not recorded. And also CTA or MRA, it depends on the size, localization of malformation, and to exclude the syndrome of Starch-Weber. Treatment. We use the laser treatment or surgical correction of some area. Lymphatic malformation is the result of the lymphatic structure's embryonic development violation. It have two forms, microcystic and macrocystic. In clinic, we will see they are manifested any age, slow growth, not regress, and also respond to injury. And in this situation, it's with the flu. After the flu, patients would say that this tumor will grow, but after some time it regress. The size of the tumor is regress. It's because of the lymphatic system. Also, it can lead to dysfunction because lymphatic malformation mostly located in lower third of the face and can be under the tongue. If we see the lymphatic malformation under the tongue, it can lead to the compression of the respiratory tract. How we will see the microcystic lymphatic malformation? It can be the type of macroglossia, the enlargement of the tongue. We will see the enlargement of papillae on it. It will contain the transparent yellow and hemographic fluid and can lead to dysfunction. By the additional methods, we use the same, the Dopplerography. And in Dopplerography, we will see the tissue thickening of the area of lymphatic malformation without clear cystic formation. Also, in this type, we use the MRI. In MRI, we will clearly see the presence by the small cyst without clear contours. In microcystic form of malformation, we will see a little bit different picture in the Doppler and MRI. We'll see the more larger cyst with clear visualization of these cavities and mixed blood flow in the walls. Treatment of lymphatic malformation we provide by the sclerotherapy with pizibanyl or bleomycin, with cystotomy in conjunction with cystectomy, surgical removal of the sclerotized areas, and also the laser therapy after all treatment to reduce the scars. One case of using the sclerotherapy with piziban, in this case you will see the before treatment lymphatic malformation with large deformity, and in MRI we can see the fluid, the large cyst on the lower of the neck. And 1 year after treatment with only piziban, we can see the reduce of this deformity. Neurofibromatosis or Recklinghausen disease. It's congenital disease with multiply neurofibromas, lymphatic malformation, neuromas of the cranial and spinal nerves, impaired endocrine and autonomic nervous system. Clinical signs of neurofibromatosis of first type. The most common is coffee-like spots on the skin, skin or subcutaneous neurofibromas, freckles, leech nodules. It's in adult age. Most not so common it's plexiform neurofibromas or optical gliomas. The other signs are mostly rare. Typical for neurofibromatosis is Darnier's tetra. It consists of pigmented spots of the light coffee color, tumors of the skin and subcutaneous cellular tissue, nerve tumors, and physical and physic impairment. Some case of neurofibromatosis of the left half of the face. We can see here the lesion nodules and skins and subcutaneous neurofibromas on different stages. On the right part of the slide, we can see the mother of this girl that don't have the neurofibromatosis but have a lot of fibromas on the skin. Manifestation of neurofibromatosis in maxillofacial region lead to big development of the tumors and disproportion of the face, of the jaws, and also it's lead to the dysfunction. This type of tumor-like disease give the growth of the neurofibromatosis. In all ages, we can't stop the growth of it. We can only make the treatment with the removing of deformative areas, but after some times it will grow one more time. So, surgical treatment we provided with participation of neurosurgeons, ophthalmologists, and ENT doctors. Also use the orthopedic treatment to somehow treat the dysfunction, orthodontic treatment. In some cases we can use the drug treatment of the anti-tumor agents, and genetic engineering is the new. The tumor suppressors have this kind of treatment have development by the time. We can see one case of the neurofibromatosis, the left half of the face, step by step. In this step, try to remove the tumor from the left part of the face. Mostly it's from the brown line. And here in CT we can see the deformation of the eyebrow that don't go to the skull. So we can provide it without the neurosurgeons. One more case before and after treatment, the neurofibromatosis. This is the common look of the neurofibromas. This is the classical look of the neurofibromas that was extracted from this child. How we can conclude all this lecture? Diagnosis of children's hemangiomas at stage of primary manifestation. We will use the drug treatment. If we have the diagnosis of arteriovenous malformation with jaw defect, mostly we need to prevent of the bleeding and the perception. And complex treatment of neurofibromatosis, it's prevention of complication. And some literature that you can use to understand more deeply this type of disease.